Good afternoon or good evening, everyone. This is Dr. Wortham, Superintendent, East Ramapo Central School District. Thank you once again for joining us with our FAQ session, part 2. We had such an overwhelming amount of questions, not overwhelming, but actually we had over 1,000 questions yesterday. We had over 600 participants. And throughout this season of our town hall meetings, we've had over 6,700 views on the videos that we have posted. So thank you so very much. And we look forward to continuing this communication loop so that we can fill our community with the information in a very timely manner. I would like to remind our viewers that you can view our plan at the ERCSD website, ercsd.org/reopening. And we would also invite you to fill out the parent preference form. The parent preference form is also found on our website. The last day to fill out the parent preference form is this Friday. We want to say that we also have accommodations for our Spanish interpreter by dialing 1-602-580-9528, and the access code is 370-5623. And we will leave that information there on the slide for your convenience. This evening, it is our intent to read the questions and provide answers that came forth on yesterday evening. That is our goal. So I will start out with questions about teaching and learning. How will BOCES programs be handled?
Thank you, Dr. Wortham. The BOCES program, students who are in BOCES should have received communications from Rockland BOCES at this point, asking them to provide the best email. In the high school, Ramapo High School has been designated to attend on A days, and Spring Valley High School will attend their BOCES programs on B days. If they're AM students, they will attend during the AM and then return to their respective buildings to conclude their schedule for the remainder of the day.
Thank you, Dr. West. What will be the method of remote learning? Will teachers be teaching live via Zoom?
Thank you, Dr. Wortham. So the method of remote learning is going to take the form of both synchronous and asynchronous. So the answer to that, it answers the second question, that yes, there will be expectation for teaching live to students during periods for instruction and ensuring engagement of students. But the actual via Zoom, no, it will be via Google Meet.
Thank you, Missy Waha. Will each teacher be responsible for the instruction of both the students who are 100% remote as well as those who are hybrid? And how will they be supported in doing this, Missy Waha?
Well, this is actually dependent on the data that comes back. So we currently are requesting responses from our parents, whether or not they are selecting whether or not they select hybrid or 100% remote. So based on that data, then we'll be better able to allocate our resources appropriately and be at a better place to answer that question. But in terms of support, the support will be given. So once we receive that data, which we should have by Friday at 10 a.m., we will use that, evaluate what the resources that we have to be able to coordinate that and better answer this question following the receipt of the data from parents.
Thank you. Dr. West, Will the remote learning schedule for grades 9 through 12 be the same odd, even, alternating schedule as hybrid, or will it be different?
Every student, thank you, Dr. Wortham. Every student in grades 9 through 12 will receive a traditional schedule of periods 1 through 8, and it will mirror whether they're in person or learning remotely. So if you're in person, you will follow on an A day 1, 3, 5, 7, and on a B day periods 2, 4, 6, 8. If you're remote, you will be following periods 1, 3, 5, 7 on an A day and 2, 4, 6, 8 on a B day.
And Dr. West, all of that information will be forthcoming to our students and our parents as well as our staff, correct?
That is correct, Dr. Wortham.
Thank you. Are the classes on Fridays, are these classes on Fridays? Are there classes on Fridays while the buildings are being cleaned?
So I will answer that question. So first, on Fridays, everyone will be, in both instruction and teachers will be at home. So all work will be done at home to allow for the buildings to be clean. Students, it still remains an instructional day. So that instruction will happen, but it will happen remotely. So just to be clear, it's going to happen remotely on Friday for both teachers and students, allowing for the deep cleaning on Fridays.
Thank you. Ms. McVeigh, will siblings who attend hybrid learning be in the same cohort groups and going to school the same week?
Absolutely. So parents will be informed within the coming days about the hybrid schedules for their young people. So we are making sure that at every building site, in each of our classrooms, we understand that we do have families who have multiple children, and we want to make sure that those multiple students, regardless of grade level band, have an opportunity to appear in school during the same week in a similar cohort.
Great. Ms. Walker, how will we handle the students with sensory disorders who can't wear masks and need up-close ABA therapy?
Thank you, Dr. Wortham. Prior to our summer program, the CDC and the Department of Health in collaboration gave us good guidelines pertaining to working with students with disabilities. And we actually addressed this in our plan, the fact that we understand that some students may initially have challenges around wearing masks. So a couple ways that we have addressed this and ways in which we can continue to address it. There is the option for students to wear shields. So we can introduce students to face coverings with the use of shields. There's also, as it's mentioned about students with ABA, which speaks to applied behavior analysis and the fact that these students do have behavior therapy, we have utilized our behavior specialists to help students to gradually become comfortable with the wearing of masks, which is something we've seen throughout our extended school year program. There was the use of videos and just to help students to become more comfortable. There are strategies that we use to move students towards extended wear of masks. And then, I mean, there's the ordering of the desk shields. And so we can use the shields to maintain instructional proximity while keeping students and the therapists or the teachers safe. So that is how we will address students who may have challenges, sensory or medical, around the wearing of masks.
Thank you, Ms. Walker. Ms. Skolnick, if a teacher tests positive and is home for 14 days, will they be teaching remotely from home? And what if their symptoms are bad? will these be taken from their sick bank? Who will the substitutes be in these circumstances? Ms. Skolnick?
Thank you, Dr. Wortham. We will be operating under the regulations of the Paid Sick Leave and Expanded Family and Medical Leave Act under the Families First Coronavirus Response Act. Basically, if an employee has tested positive or is awaiting the results of a test, they are permitted to have 2 weeks of paid sick leave without deducting from their sick leave accruals. If they have to take care of someone, say in their family, who has the virus, they also may stay home for 2 weeks at 2/3 pay. If their child has daycare or school which is closed and the employee needs to stay home with the child, they can have a total of 12 weeks at 2/3 pay with some salary limitations to care for the child. And as far as the substitutes, we would be using our substitute pool. We have a few hundred substitutes, almost 300 substitutes in our substitute pool. We would be using substitutes in those situations.
Okay, thank you.
Thank you.
Ms. Iwaha, have additional staff been hired to handle the increased cleaning? Not Ms. Iwaha, actually, Mr. Efetabo.
Yes, Dr. Wortham, thank you. The process that we plan to use for enhancing the staffing for the district in terms of cleaning is to use the existing staff that we have. And if we needed additional support, we are going to engage outside contractors to assist us to make sure that we accomplish the level of cleaning that's required by the guidelines. And we did this actually earlier on during the pandemic, where we used additional outside support, professional cleaning companies to assist us in completing the job.
Yes, so this isn't anything new. We've been doing this since March 6th when needed, correct?
That is correct, Dr. Wortham.
Thank you, Mr. Fedabo. Nurse Healy, will there be mask breaks? I know we've taken brain breaks, but will there be mask breaks?
Thank you, Dr. Wortham. Yes, there definitely will be mask breaks during the school day.
Can you tell us what those mask breaks would look like?
These probably will be very individualized in that depending on the children's schedules. But the fact that we are going to have the desk shields makes this a little easier. And I would say that the teachers will make plans to allow the children to certainly have their masks off when they're eating lunch. They would be behind a shield at that point, probably at least once in the morning and probably once in the afternoon. That's a rough idea, but there definitely will be mask breaks during the day, and it's going to end up being a little bit of a work in progress.
Yes, we shared some information with the cabinet today about mask breaks, and seemingly, as you said, mask breaks could take place during the time the students and the staff members are having lunch, as well as an opportunity when they are having physical education outside and they are 6 feet away. So that's just a brief description of what a mask break could look like. When they're not speaking and they're 6 feet away, that's an opportunity for a mask break. And I want to remind our listening audience, we're up to 404 participants now, that we do have our Spanish interpretation by dialing 1-602-580-9528. And then the access code, as you see listed here on the screen, is 370-5623. Moving forward, Mr. Afedabo, are buildings updated to meet the CDC's COVID-19 guidelines for HVAC and air filtration?
Yes, our buildings have HVAC systems that are designed to meet code. What CDC has done is provide recommendations in their guidelines. These are not requirements, they are recommendations for HVAC filtration improvements. And yes, our buildings have been checked and will meet those the requirements that are placed on us for filtration.
Mr. Afedabo, let me ask you a Deborah Wortham question. And that is the fact that we used the $59 million bond for the last 3 years. Did that support the fact that we are as an aligned with this necessity as prior to years ago? Did this help us in any way?
Oh, most definitely, it helped us in a very significant way. Although it didn't go all the way to do it for every building, but there was significant improvement in what used to be before 5 years or 6 years ago.
Great. Well, Mr. Fedebo, we can continue this conversation. It was mentioned that higher efficiency filters would be used whenever systems can take them. What if a system in a building can't take it?
Yes, there are some systems that are existing systems original to the building that will not be able to get to the highest efficiency that is recommended, not required now. So those systems, we will have to utilize natural ventilation, which again was a recommendation both in the CDC as well as the New York State Department of Education to open doors. That's what a natural ventilation is, open doors and windows to allow improved air circulation, increased air circulation. So that's the way we will deal with those conditions.
All right. Well, I understand that our buildings have passed code for ventilation systems. However, all buildings, building-wide, HVAC systems must be upgraded to a minimum of MERV 13 filtration. And if existing systems cannot be upgraded, will portable units with HEPA filtration be available for all indoor spaces?
This question is actually related to the past two questions. Mm-hmm. Again, the question indicates that HVAC systems must be upgraded to MERV 13, and that's not correct. There's a recommendation that if the equipment can accommodate it, to go up as high as 13 MERV. But it's not a requirement. Buildings are not required to upgrade their systems to meet that level of filtration. And again, the approach to dealing with this, based on recommendations from the SCD as well as CDC, is to utilize natural ventilation where we cannot get to the level of filtration that's recommended, which is MERV 13. And we do not, it's very expensive to purchase portable units with HEPA filters for every room. That's it. That's just not. I'm not sure that any groups, even businesses, are able to do that. So again, we will maintain the recommendation, which is to, in situations where we cannot improve to that level of filtration, that we utilize natural ventilation to do it.
Okay. Thank you, Mr. Fedible. And another one, will plexiglass shields be in place in offices prior to clerical staff returning?
We have ordered plexiglass sneeze guards for clerical staff desks where they engage with the public. And we expect delivery of those in the next, by the end of the month. In situations where there is no direct engagement with the public, staff should be able to utilize their workstations or return to work if that's the case, to perform their duties. But where they engage directly with the public, we have to have the plexiglasses installed when they return to work. And those are expected to be delivered by the end of this month.
Excellent, excellent, excellent. And finally, Mr. Fedible, and you said this, but it's a question, so I'm going to ask it again. Is the PPE already in the schools, or is it back ordered?
Well, there are some PPEs that are already delivered, and there are some, just like what I explained now with the sneeze guard for the secretaries, that are expected delivery is by the end of the month.
Okay. Thank you so very much. Nurse Healy, will an entire class be sent home for 14 days if a student or teacher tests positive for COVID-19?
Thank you, Dr. Wortham. Positive cases of COVID-19 will be reported to the Rockland County Department of Health, and it is also possible that the Rockland County Department of Health will be reporting to us. When a positive case occurs, there will be discussion with the Department of Health, and a plan regarding the quarantine will be followed. If the Department of Health recommends that the entire class be quarantined, then those are the instructions we will follow. But each of these will be reviewed on a case-by-case basis.
Thank you, Nurse Healy. Ms. Skolnick, what accommodations are being made for teachers that have health issues and/or a compromised immune system? Will they be able to teach 100% remotely from home?
God bless you, Dr. Wortham. Personnel is sending out a form for staff members who are going to all staff members, and staff members who will be requesting an accommodation would fill out that form, and it would be treated just the same as any other accommodation, any other year, any other time. If an employee is requesting any kind of special accommodation, the accommodation would be done on a form. The employee would give us any supporting documentation, for example, a doctor's note, and we would be communicating with that employee. A committee would be looking at all the documentation and determining if an accommodation could be made.
Thank you. And now, if a parent does not respond to the teaching option, how will the district place them? Ms. Iwaha?
Thank you, Dr. Wortham. So the district will confirm selection with parents of their choice, so either hybrid or 100% remote. After the deadline we spoke about, which is Friday at 10 a.m., we will be able to communicate to parents what their selection was, just to confirm that. And the default would be remote for those who do not respond.
All right, Ms. Iwaha. If a parent picked hybrid to begin the semester, but decided in October that they didn't feel safe sending their children at that time, can they keep remote?
Okay, so first we want to say that we really do encourage parents to stay in communication with their school building teacher, school building leader, our support services around understanding what is happening in the school building. But parental requests for any change in the instructional model selected will take place at the district level through a process that is similar to that of making a school transfer request.
Thank you. And Ms. Skolnick, will there be any job loss of staff due to this process?
We do not anticipate any job loss.
All righty. I'm going to continue to share. I believe in the fact that you say what you're going to say, then you say what you said, and then you confirm that you said what you said. So I'm going to ask the entire cabinet to ready your microphone. And I'm moving forward to teaching and learning. And ask you to come forward with an explanation of the phases. An explanation of the phases. And when you do this, when you discuss this chart, this time will you please discuss when teachers are expected to report to their buildings in person to begin the instructional year. Let's go with the discussion of the chart, our approach.
All right, so we'll begin with the approach. So we want to make sure that all listening know for the teachers, you begin with professional development on September 8th. We're very excited about that. And then our students begin learning on September 14th. So that learning begins remotely for all our K-12 students. So we want to just take a look at this visual here. So this is both for community, parents, and teachers to understand this visual aid. So September 14th to October 9th, students will engage in remote learning. Phase 2, we began October 13th, where we have a small subset, well, not small, they're about 3,500, but we have a subset of our student population that begin to enter into this hybrid model of rotations, of weekly rotations for in-person learning. So cohort A comes 1 week, cohort B the 2nd week, cohort C the 3rd week. So that rotation completes with specific groups of students, and those are listed there, which are our kindergarten, 1st grade, 4th grade, 7th grade, 9th grade, and specific populations as well. There is some additional information that will be coming out around that, but those are the populations that will start hybrid in person October 13th. Now, once they complete that cycle, the 3-week cycle, we move into phase 2. We obviously would check the conditions on previous presentations and town halls. We explain that through every part of this, we are, as the as required, ensuring that we look at the data and evaluate the situation in general, and we shared some of those considerations prior. Now, once that cycle completes, it's a completed 3-week cycle, we move to phase 3, which begins November 2nd. Phase 3 now includes those that were in phase 1 and adding now additional grade of grade 2, 5, 8, 9, 8, and 10. So that's going to be roughly around now 6,500 students that are now working within the hybrid model weekly for 3 weeks. We complete a rotation of 3 weeks with the A, B, C cohort engaging in in-person and remote learning. And then we move to phase 4, which begins November 23rd. All of our students are engaged in hybrid learning. Those students that have elected, parents have elected to engage in hybrid learning are doing so in phase 4, beginning November 23rd. And we will continue to monitor and keep our parents and communicate to both our parents and our staff around next steps. And that will continue until the end of the semester, which is January 29th. So a few weeks prior to January 29th, we will be sending out another parent preference form to see if there's any changes to parents' selection in terms of what we are doing next. Dr. Wortham?
Ms. Iwaha, when can parents expect to be notified of their child's cohort assignment?
Well, the cohort assignment is going to be mailed to parents, so that the cohort assignment will be sent via mail. So parents will get it via mail as well as through our portal. So we really encourage it'll be prior to the first days of school, but we really encourage our parents to sign up for the parent and student portal so that they can see the cohort assignments. So once again, parents can expect to receive these cohort assignments or schedules during the week of August 31st, but no later than September 8th. So that's why I stated before the start of the school year.
Can you share with us, Ms. Iwaha, how are students going to be graded?
Okay, so students will be graded as per the district's current policy. So it's going to remain what we have been doing, standards-based expectations and progressions. Parents can just expect that progress and proficiency reporting will follow the traditional trimesters schedule for our elementary levels and quarterly schedule for our secondary level.
Well, in addition to how they're going to be graded, how will attendance be taken?
So attendance will be taken and will be monitored and documented daily for student participation, attendance for both in-person and remote modes of instruction. We will be using our SIS student management system, which is eSchool, and recording daily attendance and presence through that reporting system.
And I want to make sure that we underscore this because we have received an abundance of questions in reference to special education services. Will teachers and students who currently participate in the extended school year summer program continue in-person instruction as we reopen school?
I can speak to that, Dr. Wortham. As noted, yes, it is expected for our students to return in phase 1. Ms. Iwaha gave us the overview for our general population. The expectation for our students who are primarily those students who we know have the most challenges around remote instruction, those who require 12-month instruction, and some of our needier special class populations are expected to return in phase 1. And that will also be the requirement of staff and therapists that are connected with those populations.
All right. Thank you so very much. Ms. Iwaha? Back to you.
Okay, so what we wanted to make sure of is that this particular image right here, that everyone is clear of this phased approach, what it means, that we've carefully considered all conditions and official health recommendations before we bring back the next subset, and that this phased model is for looking at instruction for our young people. So we've been charged to ensure an open school. So we want to make sure that we do it in the most conscious way, responsive way possible. So we want to make sure that everyone is clear as to this. Dr. Wortham also wanted to ensure that we answered all of your questions, and I hope that that has happened. So I am going to encourage you to attend the collaborative session tomorrow, and Dr. Wortham can speak more about tomorrow's session.
Thank you, Ms. Iwaha. Yes, we will have a collaborative session on tomorrow, and that information is on our website. And I would say to you that we are endeavoring to have and to hear your voice. And that's what will happen tomorrow. We will have the support of our consultants and elements to help us to, via Zoom, go into different chat rooms and to talk about operations, to talk about the teaching and learning process, and to talk about support. So we will be able to have live discussions with our community about the reopening, reimagining, and we're adding another word, resetting of the East Ramapo Central School District. We are so excited about the number of families that we've been able to reach, our school families, our teachers, our staff, our students, our community, via using Zoom, using technology. It's just been an amazing opportunity for us to contact with you, communicate with you, and to hear your voice. And I must say, someone sent me a screenshot of a Facebook post, and it was so cute, and it said, wait a minute, are you saying that East Ramapo Central School District has a great plan? Wow, this is the first. You know, it took me 5 years to come up with a positive Facebook post, and I was so tickled about that. And that is because in the East Ramapo Central School District, we have absolute talent, absolute talent. And I should say, we are so talented that Ms. Chris Healy has been nominated as Nurse of the Year, and we submitted that application on yesterday, and we are so excited, and we know that she will be selected and celebrated. But this has been wonderful, wonderful work. She held my hand through this process, and I'm not ashamed to say I'm grateful not only for Nurse Healy, but for all of our nurses, all of our teachers, all of our students, and our families. Our parents have become, you know, we had to evaluate our parents on teaching. We would give you a high rate because you really pulled it off this spring. So with that, thank you one, thank you all, and we'll see you tomorrow at this time in our next town hall meeting with our exchange of conversations. Thank you so very much, Cabinet. Thank you one and all community. Have a good evening.